Well, my mum, Madge, she's 86 years old. She was widowed about 15 years ago. She lives independently in her own home, which is where I am now. And she's very proud of her home. You can see she's got photos around of all of her family, and she looks after the house herself.
Always likes to do things on her own. Has never had any assistance with anything, and has lived in this home now for almost 20 years since Dad died.
In terms of her health, at 86 she's got arthritis, so that is limiting to her mobility. She uses a wheelie walker in the home now, but with that she's still able to independently shower and look after herself.
Mum initially went into hospital 4 months ago, which is a long time. It's a long time.
Initially, Mum went into hospital because she was diagnosed with a bowel obstruction. So she was admitted to a larger regional hospital near here for that procedure. The surgery didn't occur on the first day she was admitted, it was delayed. But when they did the surgery, it was a good outcome.
Mum was unable to move herself around the bed in a way to prevent her own pressure injury from occurring. But she was in fact told to do her own pressure injury care. And for somebody who is 86 years old, has had surgery, has decreased mobility anyway due to arthritis, trying to do pressure area injury on her own was just not going to happen. Mum was discharged home in the care of myself, and we discharged home. We came home and Mum said to me, "My bottom's a little bit sore." And I said, "Oh, I'll have a look." Well, I was just I was horrified, I was shocked. Nobody had told Mum or myself that she had a pressure injury on discharge, and to find that she had what I had been told afterwards, a bruise, was just not a bruise. So we went to the facility and the nurses had a look at it and put a dressing on it. This was on the Saturday morning, and they organised then for the community nurses to come on the Monday and have a look at it, and that's when they initiated the transfer to a larger hospital for further treatment and care.
There was a deterioration in her that it got to a point where it was at a worrying stage.
Due to the fact that it was so deep, it wasn't just going to heal with normal dressings being put on it every day. We needed a vac dressing that had to be applied to the wound, which is not very comfortable from what Mum said. And it had to be on 24 hours a day, 7 days a week for, I think it was about 6 weeks. So that was changed twice a week, but that involved many staff. There just wasn't one staff member that could come along and do that. And that used to be done at handover time where they had additional staff. Whilst Mum was there, she developed an infection. She developed osteomyelitis, an infection in the bone. She then needed to have a PICC line put in, which meant going to theatre for that to be inserted, and daily antibiotics going into that PICC line. For Mum to be able to come home, we've needed to organise for her to have a pressure injury mattress brought into her home, which is a bit upsetting for her because she thought that she could come home and go straight back into her own bed. Well, this has had a big impact on my sister and I. Just the travelling, taking time off work to be down here. For Mum, This has meant not being in her own home, having to be in a facility for now 4 months and still not home. She's lost her independence, just losing confidence in herself.
I felt embarrassed that it had happened, particularly as I progressively found how bad it was and the treatment that was going to be required. To see your own mother in intensive care, not able to just breathe normally, but it wasn't a lung function problem for her. It was just her body not coping with the trauma.
I understand that the nursing staff are extremely busy in all facilities. Just take the time out to explain.
So the learnings from this are that patient care is really important, because when it's not provided, the consequences can be absolutely devastating.